Welcome to IRG's Health Talk. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Angela Hauser, physical therapist from IRG Murphy's Corner Physical Therapy.
Angela, how are you doing?
I'm good. How are you, Shannon?
I'm doing great. Hey, thanks for coming down and joining us. A physical therapist and treating patients like you do. Tell us about your background, your education, and how you got interested in physical therapy.
All right. Well, I got interested in physical therapy from being a physical therapy patient myself, playing soccer for many years, back injuries. And when I went to therapy, it was really fun. And I got to really know my physical therapist. And I really knew I wanted to be in the healthcare field. And so I thought, what a great way to, be in the healthcare field, get to talk to my patients, for a good chunk of time and get to really know them and help them achieve their goals.
Yeah, that's real rewarding as a physical therapist. We really get to spend a lot of time with our patients and more importantly, see progress, see patients come in where maybe they're really impaired and then all of a sudden at the end of their treatment, they're back to doing what they like to do. And an area that you have expressed interest in and you do some treatment in this area is Parkinson's. And tell us about what options for a Parkinson's patients regarding physical therapy and rehab.
So physical therapy can help Parkinson's patients a lot. And one of the ways that we do that is through very functional movement. And we really want these patients to get moving because one of the problems with Parkinson's is they don't move very well. They get really stuck and they can't walk and their feet shuffle and they can't reach out and grab things or get up out of bed very well. So we, as physical therapists, really want to help them move better. And we try to do that through movements that are very quick, dynamic, that dopamine receptors really respond well to that, and the research has shown that.
And there's a lot of research that's showing that with Parkinson's, you described they're stuck, they have problems initiating movement. We know that they have a little bit of a shuffled gait and they have some tremors, but there's research out there that talks about movement and repetition or the cycle of movement, which helps eliminate some of those dysfunctions.
Yes, that's correct. So one of the things that we really like to do is repetitive motion at the same speed. And that's, shown throughout research studies that really helps them, stop their tremor. It decreases a lot, helps them write better. They walk better without the shuffle. They can get through a doorway a lot easier. They can get out of bed. They can, clean their house, do things that they couldn't do before. So we try to find out what that patient particularly is limited by, whether it's getting out of bed, just getting out of a chair, walking. They want to be able to walk, with their significant other a mile, or something like that. So we really look at the individual and try to look and see what we can do to benefit them as opposed to just going through a standardized program.
Right. And I want to touch on that. It's important that our listeners understand that as a physical therapist, our goal is really to assess the patient and ask the patient what they want to do. Because ultimately, that's how we're going to develop a treatment protocol is based on the functional goals that the patient wants to attain. And that's what you do. That's your process. So when a patient comes to you, you're going to evaluate them and specifically get their goals and kind of design a plan for that.
Yep, that's right. So what I do is I take the patient back, into a room and I just ask them, hey, what's been going on? How long have you had this disease? And basically find out what functional things can you not do in your daily life. Walking, going up and down stairs, just holding a coffee cup without having the coffee spill out of their hand. And then we run them through different exercises and different balance tests and just watch them walk and move and do all these things that they do in their daily life. And then I look at them and say, okay, how can we make this better? How can I make this more functional for you? And that's what really physical therapy is about. It's helping them do what they want to do.
Absolutely. You talked about getting interested in physical therapy because you were a physical therapy patient yourself. Any particular reason why you like and you enjoy treating Parkinson's patients?
Yeah, so my grandma actually had Parkinson's disease, and I watched her go through that. And I was only a middle school, high school, so I didn't really know why she couldn't talk very loud or why she couldn't come and watch our sporting events and why she wasn't, always sitting and not moving. And so I watched her go through that. And then when I learned about this in school, I was like, hey, I can really help other people be more aware of what physical therapy can do. And when, through exercise, because a lot of patients just don't know that they can just go out and move and feel a lot better. And it's something that they can't just do for 6 weeks. It's going to be a whole lifetime change for them. And so that's what we really want to hone in when they come to physical therapy is that you're going to have homework. You're going to do it every day. And it's going to be part of your daily life.
Absolutely. Great information, Angela. If someone was interested in talking to you about some treatment or some treatment options for Parkinson's, how would they get a hold of you?
So I am located at the Mill Creek office, which is called Murphy's Corner Physical Therapy, and they can email me. It's angela.houser@irgpt.com. We have irgpt.com, which is online. You can look up the clinics. And I, with another colleague, we also treat Parkinson's, and his name is Shawn Brenneman, and he's at the Bellevue location as well.
Fantastic. Thank you for your time.
You're welcome.
If you'd like more information on this topic, as well as how to contact Angela Hauser, go to irgpt.com and click on the For Health tab, or go to IRG Physical and Hand Therapy's Facebook page.